Simply put, the community-led participatory community-based surveillance and response system seeks to empower the communities of Bekumu and Bamuso, which are maritime fishing communities in the Kondo-Titi Health District in Cameroon, to lead cholera surveillance and response as a way to reduce morbidity and mortality related to cholera, which is endemic in these communities. It is creating a collaborative partnership between the communities, Ministry of Health, civil society organizations to establish a truly participatory community-based surveillance and response system. This project is funded by Ending Pandemics. In our experience, the needs of a population can only truly be determined by themselves and not based on external perceptions. As part of the development process of the action plan for the system we share here, we conducted a formative research after the initial stakeholder meeting to introduce the project and get community views on the way forward. The formative research had a retrospective part, which helped us determine the community surveillance need to be mainly on cholera followed by measles, and a prospective part, which involves structured questionnaires administered to capture needs, attitudes, as well as willingness to participate in a PCBS system. Also, 9 focus group discussions were organized across 5 communities. The results from this formative research are the basis of the context-specific needs and proposed plan for the community-based participatory surveillance system we are working on. From the moment of inception, prior to applying for the grants, we had communicated with the community leaders, administrative and Ministry of Health leaders at the central, regional and district level of the ideas we had for their contributions and support. Once the grant was approved, an approval from the Ministry of Health was provided by the Directorate of Primary Health Care, who was physically present for all 3 workshops related to the project. The community leaders, chiefs and local health administrators led mobilization which made the formative research possible. They managed the project steering committees, and some of these leaders managed to mobilize members of the communities to march and Labor Day as a way to engage community members on the work being done and to openly demonstrate their commitment to the project. By December 2025, the project would have led to a 50% decrease in outbreak events, cholera and measles within the subdivision compared to baseline data, a reduction in the average lag time from first suspected cholera case to reporting by 75%, a decrease in the incidence of cholera in Bekumu and Bamuso subdivisions by 50%, a decrease in the annual community cholera-related mortality by 40%, 50% of households having a household emergency cholera response kit, and improved community knowledge, attitude, and practice related to cholera by 50%. Based on the resource plan for the project, state CBO and committee engagements have been secured. Also, the Health Department of Reach Out is working on the final stages of a collaboration with the Faculty of Health Science, University of Boya, Cameroon, to create a Center for Excellence for Community-Based Surveillance, to be hosted by Reach Out and jointly run through an MOU by the Department of Public Health and Reach Out in partnership with the Ministry of Health through the Subdirectorate of Primary Health Care. The current estimated cost for all financial, human and material resources required to start and run the system for 18 months stands at $208,000 Canadian dollars. Of this needed amount, in-kind contributions from the affected communities to show their commitment and from Reach Out come to a total cost of $21,655 Canadian dollars. Sustainability will cost far less as the system stabilizes and the need for physical field supervisory missions reduces. This will continually improve as the Center for Excellence for Community-Based Surveillance and its partners commit to bring in more local partners to generate sustainable local funding to continue and sustain the system. A financial seed grant to cover the cost of running for 18 months, while local collaborative initiatives roll out the local sustainability and resource mobilization plan. Technical support and oversight through collaboration with all technical assistance from an entity with experience establishing a similar system successfully. Collaborative technological partnership to improve system efficiency through an effective integration bell and wheels SMS system to permit community members to be able to report directly as well. Reach Out NGO says thank you to the Ending Pandemics teams and all the viewers.